can I help you?
So I think there's a mistake on the bill, but maybe you could help me out. We got a bill, and then we realized that you guys didn't have our insurance, so we sent you the insurance, and it looks like the bill went up.
It went up?
Yeah, the first bill we got without the insurance was $600, and then the second one was almost $1,300.
Go watch that video. Go watch all of that video and then tell me again, you chuckle fuck amoebas, that we should privatize healthcare in Canada, you dumb f***.
This is the type of video that pisses me off. He's blaming California for giving people without insurance discounts on these outrageous ambulance bills because he has insurance. So he's blaming the social program for the poor people instead of blaming his insurance company for not covering his bill more. Stop attacking poor people. Attack the corporation that you're paying for that's fucking you over. It's not the California law for the discount to help people who can't afford healthcare in this country. It's your insurance company.
What's up, everybody? Welcome back to the channel. I hope you guys are doing amazing. Thank you so much for clicking on this episode. I really do appreciate your love and support on this channel. You would think that having health insurance could protect you from outrageous medical bills. What if I told you in a state like California, it could actually make things worse? A father in California rushed his child to the hospital, expecting the insurance cover to soften his hospital bill. But when the bill arrived, he was stunned that patients with insurance are actually paying more and discounts are given to patients that are not insured. How does this even make sense? Because the idea behind health insurance is that you pay monthly premium to a provider, and in return they help cover medical costs when you need care. It's supposed to help you from crippling medical bills, but it seems like this was not the case for this certain father, and maybe this is not the case with this certain insurance company in the state of California. I want us to watch these videos together, guys. Every clip and every stitch that you'll be seeing on our today's episode, credits belongs to the original creators of these videos. If you're coming across this channel for the first time, my good name is Gracey D. Kindly consider subscribing to the channel, give this video a like, and let me know what your thoughts are on the comments section. So let's dive right ahead and we'll come back with more commentary.
How can I help you?
So I think there's a mistake on the bill, but maybe you could help me out. We got a bill, and then we realized that you guys didn't have our insurance, so we sent you the insurance, and it looks like the bill went up.
It went up?
Yeah, the first bill we got without the insurance was $600, and then the second one was almost $1,300.
Okay. Yeah, so that the first invoice you received, that's a discount that you receive if you're uninsured. So you're not eligible for the discount since you are insured. And so the bill was $2,342.14. We billed your insurance. Your insurance only paid $1,078.85.
Can I go back to the discount without the insurance?
No, sir, you're insured, so you're not eligible for the discount.
If I go cancel my insurance, am I eligible for the discount?
No, sir, because we checked eligibility and you do have active coverage for data service.
Oh, I needed to cancel it before I got the service to get the discount.
You're only eligible for the discount if you're uninsured.
Okay, so I'll get cheaper health care if I'm uninsured.
If you're uninsured, you're eligible for the discount, correct?
Is this common? Like I pay for insurance and I end up paying more out of pocket because I pay for a premium? That's wild.
No, this is just a new law that passed or started 2024 AB 716, and the law is if you receive a discount if you're uninsured.
Okay.
So when we first send a invoice to the patient, we bill them as if they're uninsured. If you're insured, unfortunately, you're not eligible for the discount.
Okay, so just if I have the incentives straight here, if I want to pay less for medical care, I should cancel my insurance if my daughter needs life-saving medical care?
I'm not sure. I don't know, sir.
You
should cancel your insurance. I'm just letting you know that discount's only for patients who are uninsured.
Okay, that is special. That is a special law. So there's no way to put that discount onto an insured person. Only the uninsured people get that.
Correct.
This is exactly why I tell everybody that the American healthcare system, the insurance system, is the biggest Ponzi scheme that has ever been perpetrated on the American public. I see it all day, every day, and this, while horrible, is sadly the tip of the iceberg. You are paying for thousands and thousands of dollars worth of insurance, and you're getting very little service as a result. Because you got to remember, insurance companies answer to shareholders, not patients. So you're never going to be their priority.
You've really misunderstood this situation, kind of because that guy lied to you. It is not that uninsured people in California are getting a discount that means they're only being charged $600 for the same ambulance ride that you got. What has happened is, in California, the state government approached healthcare providers and said, this is the number of dollars you are allowed to charge people that don't have legal representation. Because that is quite literally the majority of what an insurance company is. When you get insurance, what that insurance company does is it goes to healthcare providers and it says to them, we will allow you to charge this number of dollars to all of the people in this particular group for all of these particular services. Of those amounts, we will guarantee payment of this percentage of that amount. Agree or disagree. And then they sign a fucking contract, and that is the bill that you get when you have insurance and you go to that particular healthcare provider. Now, that healthcare provider knows that there is a large percentage of the population that, even if they have insurance, they are going to struggle to pay that difference. So what do? They charge you an astronomical amount of money above and beyond what the insurance company has already paid them because they agreed to let them do that. And then when you don't pay it or you can't pay it, they sell it to a debt collector who then pays them to buy your debt. They're not going to get what you owe them dollar for dollar. Most of the time, they get like a half a penny all the way up to a nickel per dollar when they sell your debt to a debt collector. But this ensures that they are going to recoup an astronomical amount of money for a thing that didn't cost anywhere near that much. You have shitty representation. Be mad about that. Your insurance company agreed to the price that they are charging you. They negotiated that for you, and they did a shit job. It isn't higher for you because uninsured people are paying $600. It's higher for you because your insurance company agreed that's how much you should be able to pay. You, sir, are mad at the wrong people. Be mad at the medical industrial complex. Be mad at the pharmaceutical industrial complex. Be mad at the insurance industrial complex. And be mad at the federal government for not doing for everyone what California did for their uninsured. I hope you learned something. Have a great night.
I think the most egregious part of that whole thing is that the cash price is less not only than what he has to now pay because he has insurance, but they've already gotten more than what the cash price was from the insurance. And now they're looking for more than that, more than what the insurance gave him from him. Like, where does that make sense? And that's with insurance. Like, why are we even paying for insurance if the cost with insurance is going to be $400 more? And why does the doctor's office get to make out like a bandit? Because $900 if it's cash, $1,100 from the insurance company, plus $1,300 from the person if it's insurance.
You should go watch that TikTok. I'm waving a magical wand over America to end all the corruption that's going on over there. Oh my gosh. So this guy got a bill for $600 for an ambulance ride for his daughter. And when he sent it back in, he gave his insurance information. And when it came back, he owed $1,300. How does that work out? When are people going to actually stand up and rise together? Ain't nothing going to happen when we're all just sitting on our asses doing nothing. TikToks like this should make you irate. Yeah.
My literal 20th time I've made this video. Go watch the Robbie show. He's an actual fucking lawyer dealing with this nonsense over insurance in the state of California with an ambulance ride. So his bill goes from $600 to $1,300 because they realized that the insurance wasn't included on the ambulance ride. And then he got a bill making it 210% more expensive. It went from $600 to $1,300. I've gotten strep throat 3 times in the last 8.5 years. I go to HEB. I live here in Austin, Texas. Lordy, HEB, hear about our butts. When they think I have insurance, it's $35. When I say I don't, I always pay $12. Why?
Go watch that video if you haven't seen it. But I'm experiencing something similar. If you don't know, I have a ton of health problems that started about 2 years ago from long COVID. And the beginning of this year, in January, when our policy renewed with the exact same insurance, nothing changed, my medication cost went up drastically. For example, I have one medication that is an over-the-counter medication that you can get over the counter, but my doctor says that the one that you get like from a prescription is like a little bit better quality, and it's actually cheaper before to get it through my insurance. The over-the-counter medication, if I get the generic one, is about $13 or so, $14 for a bottle. That should last a couple months. To get it now through my insurance, it is $75 for the exact same thing that used to be, it was like $1 before. Like it would cost me like $1 like 2 months ago, like before the new year started. Besides that, they have completely stopped covering, for some reason, a lot of my doctor's visits. So now instead of, getting what I was before, which it's not, my plan has not changed at all. They've just stopped covering things randomly. They've said that, I've had enough, tests and enough doctor's visits and I don't need them anymore, even though my doctors are like, you very much need them. I was in physical therapy for like 2 years. I can't go to any of that shit anymore. I can't afford it. Because I can't work full time anymore because of what has happened to me. But yeah, they're not covering shit anymore. I don't know what happened. And not that having insurance before was great, but I guess it was better than being uninsured. But now, yeah, it's literally costing me more to use the insurance.
Health insurance is supposed to protect us from devastating medical bills. We pay into it every month, expecting peace of mind, expecting that this insurance company that we actually pay premium every month, that we do pay, for us expecting in return, what we do expect is for this insurance company to cater for our medical bills so that we don't have to break our accounts when it comes into such emergencies. But now this dad asked for an ambulance for him to save his daughter's life, and now he was gonna pay $600 without the insurance. That is the discount that he was being given from the $3,000 and the total that you've had. But now, after they actually gave out their insurance details, the bill got to be more than what they were supposed to pay in the first place. I mean, I wish they knew so that they couldn't have to give their insurance details and they could have just paid the $600. But I know the dad thought, or these parents thought, that with the insurance, maybe we're gonna pay something like $300 or maybe something like $200, because they pay a premium every single month. For them, expecting the return that they do expect is for this insurance company to cover for their or help them is the medical bills that they'll get in case of such emergencies. So there's been a saga with the health insurance CEO that we also, and when I went through this comment of this video, people are like, you know what, now most people understand what the guy that unalived the healthcare CEO, was going through. Because as the lady is saying, it's these insurance companies that they're actually supposed to be there for them to go and make a better deal for you with these, hospitals or with these healthcare hospitals, for them to come up with the best of the best prices. That's why we pay insurance for the insurance companies to go and negotiate out there to give us the best deals. But this is not the case with this state, or I don't know if it's this specific insurance company that this guy that you've seen on the video is using, because there is no way that he's actually even paying more than what the insurance is covering after, he said that he has insurance and now he has to pay multiple of what he was gonna pay without the insurance. So I don't know, as the guy is saying, this has nothing to do with the state of California. It has everything to do with the insurance company that he's using. In a perfect world, this is how insurance should work. You pay monthly premium, the insurance company covers your medical bills when needed. You get access to doctors, hospitals, and treatment at lower cost. It's meant to protect you from medical bankruptcy, give you access to better care, and cover preventive services like checkups and vaccines. And that's why you see in most cases, this is how insurance do work like. But honestly, me personally, I don't even believe in these insurance companies. And the only thing that actually advise people that it's good to insure is things like your car, your business, big things. But when it comes to health insurance, most of these companies, not only in the United States of America or not only in the state of California, most of them are just taking advantage of people and they're not really helping. Because there are some insurance companies, you go to certain hospitals and they be like, no, we don't accept that insurance company, we don't work with that insurance company. There's so many cases that I've had when it comes to insurance companies and hospitals saying that we only accept certain insurance companies. And most of these companies that some hospitals are okay to work with are the ones that you have to really pay a lot when it comes to monthly premiums, which is not fair to the citizens. I mean, healthcare should be very affordable to each and every other citizen. It doesn't matter which country that you're from. And also, I was doing a little bit research and I got to realize that even with insurance, you can still end up with outrageous bills, because the system is designed to favor profits, not patients. And this is what's happening in this case that you've seen on these videos. And the lady, as the lady was saying in the first place, is that this insurance, they only care about their investors. They do not report to you, or they do not answer to you as the patient or you as the premium or the cover holder. They do answer to their investors and they need profit. It's just a business just like any other. And the problem with these billionaires is that they don't care about what's happening in people's lives as long as they've made their profit. And the only time that they care, or the only time they wanna show that they care, or the only time that they listen to you, is when you had them in their pockets. That is when billionaires get to learn on listening to the people that are actually helping them make these billions. There is also unfair pricing for insured patients. Like some hospitals give discounts to people without insurance while charging insured patients more because they know the insurance company will pay. But now in this case, this guy is supposed to pay some huge amount of money than what he was supposed to pay, and the insurance has only covered a little bit of that, which is not fair at all. Also, when it comes to insurance, there's always surprise bills and hidden fees. Ever heard of out of network charges? Never heard of that until I was doing this research. Even if you go to a hospital, your insurance covers one random doctor might be out of network, and suddenly you are hit with a massive unexpected bill. Never heard of that before. I just got to hear of that or get to learn of these when I was doing this research. So what is the real reason as to why we do actually pay insurance? I think in most cases it's because of fear. You know, you don't want to be sitting there and maybe you get into an accident, or maybe you get a serious health issue that requires a huge amount of money. Like, let's say you don't want to be slapped with a $50,000 for medical bills. So this is why most people pay insurance, and this is why these companies, they know at the end of the day we're gonna pay this insurance. And in a country like in the United States of America, whereby there's so many diseases that are actually seeing so much happening, and healthcare is quite expensive, and I don't know why it has been put like this. I mean, in all the things that you can actually give to your people, in all the things that you can actually give to humanity, healthcare should be affordable to each and every other person out there. But this is not the case in the United States of America with the cases that we've been seeing, like the case of Luigi and what happened. And yeah, I feel so sorry for this dad that he didn't know that this was, you know, this was gonna happen. He was just trying to save some dollars, you know, with his insurance cover, and instead he was hit with a larger amount than whatever he was being asked before without the insurance cover. Tell me, do you think this is fair? Do you think this insurance company is ripping him off, or this is how things are supposed to be? Let me know what your thoughts are in the comment section. Thank you so much for watching up to this part, and until the next episode, bye.